Hi, many people may be suffering from shoulder pain, and shoulder pain can arise for various reasons. It can be due to some underlying injuries to the tendons in the shoulder, or it could also be due to arthritis involving the shoulder joint or the acromioclavicular joint. So, typically, one may find that pain starts to arise after an activity involving an outstretched hand or trying to lift something heavy. And typically, there are important tendons in the shoulder which initiates movement, and sometimes due to overstrain you can have inflammation of the tendon. So if you look at the shoulder joint here, you'll find that there are important cuff muscles which support the shoulder, and typically after a particular injury the rotator cuff tendons can be injured, and this is called tendinitis, which results in pain. So again, it is very important that if you have shoulder pain, which often occurs when you try to initiate some amount of movement or when you're trying to lift something heavy, then this signifies that it could be an injury involving the tendon. Sometimes in someone who's older or who has got some underlying degeneration of the tendon, when the person happens to fall on an outstretched hand, it can lead to sudden tears or even a complete rupture of the tendon. And in that case, one may find that it is not possible to lift the entire arm. However, if it is just due to pain with no limitation in movement, it could just simply mean there is inflammation of the tendon due to an overstrain or some amount of bursitis resulting from chronic degenerative changes around the tendon or beneath the acromioclavicular joint. Sometimes an individual may also experience impingement symptoms where at a particular arc of the movement of the shoulder one may experience intense pain. So these are some of the reasons why one may have shoulder pain, and it is important that if this persists, then you should seek an early consultation to diagnose the problem. Typically an X-ray will be done, and often an MRI may be advised to delineate the underlying pathology of concern. Thank you.